Good morning, good afternoon, and good evening according to your time zone. And I wish you Merry Christmas for all of you, wherever your country is. I'm Dr. Mina Kellini, an assistant professor of pharmacology, College of Medicine, Maine University. I'm also a practicing general practitioner since 2006. What I'm going to present in this short video is a conclusion evolved from my clinical experience with several COVID-19 Egyptian patients and an African protocol that has been adopted and used successfully for those patients who included adult children as well as 2 pregnant ladies. Both have delivered, giving full-term healthy offsprings. And I just want to say that any mentioned drug in this video must be only considered by a licensed physician because anything we are going to present in the media is intended only for medical practitioners. Yes, the ordinary people can watch it, okay, but they should, and you should consider it with your physicians, with your health authorities in your countries. And I've sent emails, I believe, to all ministers of health in Africa, European Union. I've tried to contact all stakeholders and the health authorities, just wishing that this protocol using inexpensive and relatively safe FDA-approved drugs might be considered to save lives, precious lives that are being lost every day because unfortunately some articles might be ignored for some reasons because of this flood of COVID-19 published manuscripts. I don't know. But in every published article published with the name of Egypt and with the name of Africa, I faced a lot of difficulties until an honorable editor-in-chief just considered to send it for peer reviewers. And those peer reviewers, honorable peer reviewers, gave me good remark and accepted eventually, published in Q1 and Q2 journals. So what I'm going to present is a conclusion based from 3 published articles. The first article was published on late April, okay, published exactly on the 30th of April 2020. The name is Nitazoxanide Azithromycin combination for COVID-19, a suggested new protocol for early management. And in this article, we have pointed out for Nitazoxanide mechanism, a suggested mechanism at this time that may help COVID-19 patient if administered early during the course of COVID-19. And we have presented an opinion that it is about the restoration of interferon homeostasis that made azithromycin, ivermectin, and BCG vaccine at this time be considered at this time for COVID-19. And on the same basis, we have suggested Nitazoxanide, explaining the pathophysiological as well as pharmacological approach that we opted for Nitazoxanide, saying it is the best available option that we may and should focus on. At this time, only 8 clinical trials were recruiting patients, difficult in recruitment, all in developing countries. But currently, there is about 24, 25 registered clinical trials, about 5 in USA, and 2 completed studies in Brazil. So we have already, and by the way, recently, an observational study by American and Brazilian researchers shows that Nitazoxanide, azithromycin combinations that we have said earlier that it is best option, showed them provable efficacy. It is controlled trial, by the way. So Nitazoxanide, azithromycin combination already proved and is being proved beneficial by the other undergoing clinical trials. And regardless of this clinical trial, my clinical experience since I published this protocol or this suggestion, it has been very favorable, and this has been represented in the full description of this protocol, which is now called Diclofenac potassium Nitazoxanide Azithromycin novel COVID-19 protocol used in adults, children, and pregnant patients, coded be the magic bullet. This is a preprint found at Authorea. It has been accepted, by the way, by an honorable pharmacology journal, but at the stage of publication, I've added more information. I wanted to clarify my ideas, and this was not accepted by his honorable editor-in-chief, and I have respected his decision and shared with him in withdrawing. I've already submitted and sent it elsewhere, and this preprint is now available for everybody because I have nothing to hide. I'm proud of this protocol being from Egypt and from Africa, and I do believe that it saves life. So this is my first paper, and we have mentioned that nitazoxanide has a potential to treat COVID-19 basing on the suggested at this time interferon system. Most recently at Nature, we have a published article from UK called Genetic Mechanisms of Critical Illness in COVID-19. And the honorable researcher said that they have found some genes that are related to the severity, that are related to the morbidity and mortality of COVID-19. And those genes were related to interferon, as we have suggested before, and also related to inflammation. And we have also suggested that non-steroidal anti-inflammatory drugs, when used early in COVID-19, look at this title, published at Biomedicine and Pharmacotherapy, was available online on the 4th of November, 2020. The title is Early Use of Non-Steroidal Anti-Inflammatory Drugs in COVID-19 Might Reverse Pathogenesis, Prevent Complications, and Improve Clinical Outcomes. And in this specific article, we have provided a theory for the pathogenesis of COVID-19. We have named it lymphocyte distraction theory. I recommend the visionary researchers who have not read this article before to reconsider it and see it. This advice, this medical advice to use non-steroidal anti-inflammatory drugs have also been proved in my clinical practice with those COVID-19 patients, including two pregnant patients. At least in the abstract diagram of the protocol, we have, if you will examine it, you will see that I've said if we have a SARS-CoV-2 positive case, we will see presence of symptoms and signs or not. If no, this is a carrier, and I've only recommended isolation plus minus zinc and vitamins. But if there is symptoms and signs suggestive of COVID-19, okay, so then he is a patient, okay, or she's a patient. After this, we looked for the temperature. If it is below 38 degrees centigrade, I've said if there is no diarrhea, we will give non-steroidal anti-inflammatory drug. If associated with diarrhea, we'll give non-steroidal anti-inflammatory drug plus nitazoxanide. But if the temperature is above 38 degrees centigrade, whether diarrhea is present or not, I've recommended to use the full protocol, non-steroidal anti-inflammatory drug, nitazoxanide, and azithromycin. And in non-steroidal anti-inflammatory drugs, I've used diclofenac potassium for most of cases, and I've also originally and in some cases I've also used ibuprofen. Both were comparable results. I have received feedback from other colleagues, and they gave me that they use this protocol and they used celecoxib, and it was the same efficacy for them. So non-steroidal anti-inflammatory drug in my clinical practice, as well as others who have used this protocol, had very favorable outcomes in preventing complications of COVID-19. So I also encourage those researchers to see this or to examine this published article or preprint. Hopefully it will be soon follow the other published articles. By the way, this dilemma regarding whether or not we should use non-steroidal anti-inflammatory drug has been fully explained from my point of view. And unfortunately, I've showed a horrible mistake from my opinion that has been made when some honorable researchers have claimed that ibuprofen has deleterious effects if used for COVID-19. I fully explained why I saw this as a horrible mistake, because it eventually led to several consequences that led to avoidance of non-steroidal anti-inflammatory drug in COVID-19, hesitancy, fear, and the title was Angiotensin Converting Enzyme Inhibitors, Angiotensin Receptor Blockers, Ibuprofen, originally linked to COVID-19's other side of the mirror. I also hope you might consider to examine this article, which was published at Inflammopharmacology. It was published on the 12th of September 2020. In the preprint, in the published preprint, explaining my clinical experience with COVID-19 patients, I've also encountered two complicated cases. I've used the parenteral ketoprofen to manage the high fever in those patients. And for the 22 and more, by the way, more than 22, but I've also presented 22 cases, either confirmed by PCR or highly suspected. We have also presented CT, we have presented some CBC with lymphopenia and leukopenia. We have also presented some patients who were diagnosed by rapid IgM antibodies. So in all those cases, all COVID-19 serious or hazardous symptoms have been relieved in less than 2 weeks. Many or most of the cases who have received the explained protocol early in their COVID-19 course have been fully relieved within the 5-day regimen. Yes, it is a 5-day regimen. So from my point of view, Africa has presented its case and is presenting its case that we have a protocol that uses readily available and non-expensive FDA-approved drugs. And we wish that researchers from all over the world might consider expanding the research on this protocol, perform formal double-blind clinical trials. We have asked for this in 2 of already published articles, and we hope to see it as soon as possible. Now we currently see a lot of clinical trial regarding Nitazoxanide, but I believe the cornerstone in this protocol is non-steroidal anti-inflammatory drugs. Yes, non-steroidal anti-inflammatory drugs, when combined with Nitazoxanide and Azithromycin, can save lives. This is my point of view, and I'm really thankful for your prayers. I really wish to see a lot of people praying that we might help to save lives, because, as you know, vaccines will not be readily available, especially for developing countries, at least in the near future. And hopefully we might focus on this protocol, on these results. I'm open for any discussions. My patients are available, and you cannot imagine the hardships that are faced in every published article. Because from my point of view, many say it is coming from Africa or it is coming from me, so it is doubted. No, it is not doubted. We know nothing but faith, honor, and dignity, and we try our best to save lives. This is the house we have already made when we graduated from colleges of medicine, and I'm proud. Thank you very much, and have a wonderful day.